Nitrates and nitrates, one of the big things we can see is headache. So a headache may occur. Why do you think the headache is occurring? It is occurring due to the vasodilation. So the vessels in your head are dilated, and that can result in pain. We typically treat this with Tylenol. It goes away as the person gets used to the drug. A big thing here is hypotension. So these nitrates and nitrates can cause significant hypotension. If something causes significant hypotension, what are we concerned about? The big F word, falls, right? So it's a big safety issue. So 3 different medications that you may see, these all have nitrate or nitro in the name, okay? So nitrate, nitrate, nitro. That way you're gonna know that they're in this class. This class causes a significant amount of vasodilation, which as a result can result in decreased blood pressure. But why are we giving these drugs? What is our indication for these drugs? Angina. Good. So isorbide dinitrate, which is isordil, isorbide mononitrate, which is Emder. These are helpful because you take them consistently. Nitroglycerin, you can do that as well, but nitroglycerin, a lot of the times we take as needed. So this would be somebody who has the angina. At home, they have the nitroglycerin, so they're able to take it if they need it. Nitroglycerin, this type is given sublingually. And this is commonly, you'll see this bottle. It has this brown, and that is to decrease the amount of light to it. Just think that nitroglycerin pills are like really sensitive to everything. So if there's light or heat, they just want to break down and stop working. So we want to have this patient keep it in a cool, dark place that is available to them if they experience the chest pain. So lots of different things we can give it for. We talk a lot about angina, but again, we can give it for hypertensive emergency and hypertension, remember, because it vasodilates. Now, when we're giving cream, we give transdermal nitroglycerin sometimes, it needs to be covered. So you can cover it with like a plastic card or plastic wrap, as long as that ointment, that cream is covered on the skin so it does not rub off. Another thing to know about nitroglycerin is that you need to have a nitro or a nitrate-free period. If we do not have that free period of nitroglycerin, we can develop tolerance. If you develop tolerance to nitroglycerin, so it doesn't work as well, what are you going to take when you're having an emergency and you're not getting blood through your coronary arteries? I'm going to tell you there's not anything else. So nitroglycerin is the go-to. You do not want to develop tolerance to it. So we're going to have our patients have a nitrate-free period. All right, classroom response questions. So the nurse is planning to teach a client about appropriate use of nitroglycerin and should include which instructions in the teaching plan. Should this patient keep nitroglycerin in a shirt pocket? What do you think? Should they stop taking nitroglycerin if a headache occurs? We just talked about those. Should they take up to 1 dose of nitroglycerin 5 minutes apart? Well, that's one we didn't talk about. And then should we replace the medication before it reaches expiration date? Are there any of those that you would say, absolutely, we need to do this? So even if you didn't know that third one, and I don't want you to say yes to something that you don't know, I want you to make an educated guess, right? But we need to replace the medication before it reaches expiration date. I think that would be appropriate for every medication. So nitroglycerin is relatively unstable, and the client is taught to check the expiration date and replace the medication before it expires. The tablet should be kept away from heat, light, and moisture. Headache is an expected side effect of this medication and usually diminishes as the client becomes accustomed to the medication. The client should take 1 dose of the medication. If the chest pain is not relieved, the client should seek emergency cardiac care. So that would be calling 911 or going immediately to the emergency room. I always encourage them if they have chest pain to call 911, because if they're actually having a heart attack, the paramedics can help that patient and provide pre-hospital care to help save their life. Another anti-anginal drug that you may see is ranolazine or Ranexa. It's used for chronic angina. These are people who have consistently chest pain due to a lack of blood flow. So let's talk about how these drugs work for angina. You can pause the video here and write your answers, but we'll go through them. So nitrates and nitrites, they're going to vasodilate, right? That's opening up all the vessels. The vessels we're concerned about are the coronary arteries. Beta blockers decrease the heart contractility, and they decrease the oxygen demand of the heart. So remember, we can get more blood to the heart, or we can have the heart need less blood. So we remember with our beta blockers, we can see decreased contractility. Now, is that an inotropic effect, chronotropic, or dromotropic effect? Contractility is inotropic. So that makes sense. We know beta blockers have an inotropic effect. Now, if our heart is hurting, we're getting chest pain because our heart needs a lot of oxygen. If we decrease that contraction, decrease that rate, our heart is going to need less oxygen. And if we do that, our heart may have a sufficient amount of blood and oxygen, which would result in a decrease in the angina. Calcium channel blockers then do both. They decrease contractility and they cause vasodilation. All right, so phosphodiesterase inhibitors. So what are these? Phosphodiesterase inhibitors inhibit the action of phosphodiesterase or decrease cyclical AMP, whatever, we don't really care about that. We care that it results in a positive inotropic response and vasodilation. So if we have a positive inotropic response, what happens? We're increasing contraction. So if we're providing inotropic support, we're increasing contraction in heart failure. So if our heart is failing or not doing very well, we can give a phosphodiesterase inhibitor to cause it to do better, to increase the contraction. So I don't need you to know contraindications specifically. You can always look those up. This medication, the phosphodiesterase inhibitor that we'll talk about, is milrinone. So this is an IV-only medication. Some adverse effects, it can cause some weird electrical activity through your heart. Now, if we say ventricular dysrhythmias, you get a little concerned. Your ventricles are really important to putting blood out through your body. So when it says ventricular, you have a little concern for that. Some different things that can happen: hypotension, which is decreased blood pressure, angina, low potassium. But phosphodiesterase inhibitors, remember, provides inotropic support in heart failure. So that increases contraction. Okay, cardiac glycosides. I would argue that these are this is one of the most important classes of the medications, just because it has a narrow therapeutic index. We know that anything with a narrow therapeutic index can be dangerous. So let's talk about this. Our cardiac glycoside that we'll talk about is called digoxin. Respect digoxin, it is important. So our actions here, we have a positive inotropic effect. What is that? What are we increasing? Contraction. Chronotropic, what are we decreasing? Negative chronotropic. Heart rate, good. And dromotropic, what are we decreasing? Electrical activity. Okay. We also have cholinergic stimulation, which increases filling time between the heartbeats. Our indications here are heart failure, right? So if I'm increasing contraction, I'm going to help my heart work. And atrial fibrillation. Atrial fibrillation is a dysrhythmia. If I have something that decreases electrical activity through my heart, that can help with an abnormal heart rhythm or a dysrhythmia. So a few facts here. We've got some very important things about digoxin. So let's talk about these. So digoxin is a heart medication. So remember the class is cardiac glycoside. Now, we need to make sure our heart rate is 60 plus before we give this. Why? What effect did digoxin have that would cause us to need to monitor the heart rate? So it had a negative chronotropic effect, which means it could decrease heart rate. So where are we checking a pulse? We know that we've got to check a pulse. Where are we checking it? Where is the most accurate place you can check a pulse? The apical. You're going to check an apical pulse, okay, because it has a negative chronotropic effect. You're checking an apical pulse for how long? 60 seconds. Very good. So that's a really important thing to know. So know that. Another thing about digoxin is it has a narrow therapeutic index. Remember, a narrow therapeutic index means the level between effective and toxic is really narrow. That means it's a drug that can be dangerous. So our digoxin level, you're going to need to memorize this, is 0.5 to 2. Maybe put it on a note card. This is just one that a note card would be really helpful because it's memorization. So digoxin, the level is 0.5 to 2. So here's a classroom response question. Which of the following is a contraindication, which means do not give for digoxin administration? Blood pressure of 140/90, heart rate above 80, heart rate below 60, or respiratory rate above 20. Okay, so blood pressure of 140/90, is that okay? Yeah, I don't think digoxin is going to increase the blood pressure. That's okay. Heart rate above 80, is that in normal limits? Yes, because our heart rate is 60 to 100. That's normal. A heart rate below 60, are we okay with that? No, because it's an abnormal vital sign. So we think, okay, does digoxin decrease the heart rate? I know I have to monitor a pulse, so I know that's really important. And this is the dangerous thing, so we'll hold on to that. And then respiratory rate above 20. Have we talked about digoxin doing anything respiratory? No, it's a cardiac medication, okay? So if you have a heart rate below 60, you're concerned because digoxin can decrease the heart rate since it has a negative chronotropic effect.